It's a lively day at this activity center for senior citizens in Taipei. This morning's class is about edible art, with the seniors making pictures out of orange slices and nuts. Every day brings something different: drawing, singing, physical activities, even classes teaching those who never went to school to read and write. The Hongdao Senior Citizens Welfare Foundation runs several centers like this across Taiwan. They're open Monday to Friday to anyone 65 and up who doesn't need too much extra care for a monthly fee of around $30. That includes a group lunch every day. The goal is to keep seniors active and, crucially, in good spirits at a time of life when emotions can get dark. The 65-plus cohort in Taiwan has had the highest death rate from suicide each year since at least 1994. Studies show Taiwan's far from the only place where suicide among seniors is a problem. But for rapidly aging Taiwan, it is an exceptional problem. This year, the 65-plus age group is set to make up a full fifth of the population. As one of the foundation's Taipei team leaders, Zhan Shanzheng explains, depression is an issue for this age group, and getting help isn't always something people of that generation think to do.
大概每6位长者当中就有1位是有心理忧郁的状况，可能他们过往的生活习惯当然是生病才会去求助医疗的单位，但是在心理健康这一块相对是比较忽略的，因为他们一方面可能我觉得这也是台湾文化的关系，文化跟背景的关系，他们不觉得心理或者需要諮商这一块是会需要被重视的。
Though he does say when they bring up the idea of getting help in the center's classes, there's a positive response. As he sees it, the decline that comes with aging, loneliness, and a lack of purpose after retirement are 3 of the big risk factors for poor mental health. And that's where these centers come in. They provide stimulation, social time, and something to look forward to. Most of the senior citizens come every day, sometimes for years now. They say they're happy. And having a space like this one is a big reason why.
以前一个人在家里，好像无所事事啦，整天不知道要干什么。来这边以后就觉得充实多了。
之前都在家里很孤单，不管一个人啊呢，来这里都朋友很多，就很快乐啊。
The people who can come to centers like these are the lucky ones, though. Many in this age group can't leave the house anymore, and the decline people experience once they're housebound is noticeable.
一个长辈本来能够来，后来因为身体不舒服了不能来，那我们改成一个家访，就变成去拜访那个长辈，变成不能去拜访，然后长辈就心里就很来讲的时候就很，我们台语讲就无助的。
It's much the same story in rural parts of Taiwan, where these kinds of centers are hard to come by. With their limited reach and resources, private groups like the Hongdao Foundation can only do so much. So how is the government handling this growing public health problem? Health ministry officials were unable to speak with TaiwanPlus directly, but did give their 8-point mental health strategy for seniors. The points include extra screening that got more than 4,000 people referred to help in the first half of this year. There's training for those who work with seniors to seek out signs of suicidal thoughts and report them. And crucially, there's a sort of suicide watch list. People over 65 who've reported a suicide attempt get classed as high risk. And for those with more than one attempt, home visits are more frequent and longer. But some groups that work with senior citizens see gaps and ways the government can improve.
是不是能够加强跟我们来合作，那让这个访视的密度可以再增加。好，因为这些像我们访视的都是一些经济弱势的、贫困的、独居的，甚至拾荒的长辈，所以其实他们受到的关注是很少的。所以每次在我们每个月的访视当中，其实1个月可能就只有我们去看他。
Back at the Hongdao Foundation's Activity Center, some of the seniors say mental health is critical as people get older.
年纪大了，那要心情要快乐，不快乐就是很闷呐，这身体就很不舒服啊，那样就是自然都会很不舒服啊。快乐来了，什么都好了。
How best to spread that happiness among seniors, though, is a matter that attracts many viewpoints. And with Taiwan society rapidly aging, the issue is only going to get more pressing. Kris Ma and John Van Trieste for TaiwanPlus.